Mayo Clinic's new diet program.
The diet was formulated here at the Mayo Clinic in Rochester, Minnesota, the gold standard of medical excellence. And after years of scientific and clinical research conducted here, the result is a list of habits and attitudes that really work. Dr. Donald Hensrud says the Mayo diet was tested on dozens of clinic employees who all lost weight.
It's the healthiest way to lose weight quickly there is.
Dr. Donald Hensrud is the editor-in-chief of the Mayo Clinic Diet Book.
People generally know they need to eat less and exercise more. They don't need us to tell them that. What they need are strategies, an action plan that they can implement and help them to carry that out.
The Mayo Clinic diet consists of 2 phases. The Lose It phase is 2 weeks long, and people make quick changes in their habits.
There's no counting calories or carbs. What you do is adopt 5 healthy habits and break 5 bad ones. The healthy habits are: eat a good breakfast, eat fruits and vegetables, eat whole grains, eat healthy fats like olive oil and nuts, and get moving with some daily exercise. The habits to break are: no TV while eating, no sugar except what's naturally in fruit, no snacks except fruits and veggies, eat moderate amounts of lean meats, and no eating at restaurants unless it fits the plan.
The diet is divided into 2 phases, Lose It and Live It. Lose It is the first 2 weeks. It's a jump start, a sort of boot camp where you lose 6 to 10 pounds. Live It is long-term and less intense, where you lose 1 to 2 pounds a week until you reach your goal weight. In the Lose It phase, you add these 5 good habits: a healthy breakfast, daily servings of 4 vegetables and 3 fruits, whole grains, healthy fats, and 30 minutes of exercise a day.
In the Lose It program, what we want people to do is to dive right in. And it's going to be challenging for a while, but once you start seeing results right away, start having more energy, then it builds on itself, and it can be easier to sustain over time.
You also break these 5 bad habits: no sugar except what's naturally in fruit, no snacks except fruits and veggies, no big portions of meat or high-fat dairy, no restaurants unless the meal fits the program, and no TV while eating. Plus, you can only watch as much TV as you exercise.
At first I thought that was really going to be hard. It was no TV without exercise. But in reality, the gym has a TV. So if I wanted something to watch, I just got my stuff and went to the gym. So it wasn't that hard.
In the Live It phase, participants eat according to the Mayo Clinic Healthy Weight Pyramid. Lots of fruits and vegetables, followed by progressively lesser amounts of whole grains, lean protein and dairy, healthy fats, and sweets. The pyramid is based on the concept of energy density.
Some foods have a lot of calories in a small volume. Butter, for example, or sugar. Very large number of calories in not much volume.
Sugar has no nutritional value other than providing calories. It may have a slightly toxic effect in the body in some ways. It displaces other foods that provide more nutrition.
Plus, it may make you gain weight.
Limit added sugar to less than 10% of total daily calories.
Other foods are more bulky. They have a lot more volume or weight, but not a lot of calories. Fruits and vegetables are in that mode. We recommend all the vegetables and fruits that people want to eat. They can get full before they get in enough calories to gain weight.
She's lost 50 pounds, Donald's lost 30, and they've kept it off for over 6 months. Now you might wonder if they felt hungry on this plan. The answer is not really. The calories in 1 donut equal about the same as 6 heads of lettuce, and the calories in 1 brownie this size, about 4 apples.
There's enough experience here at Mayo and enough research has been done that we feel comfortable putting our name on this dietary program.
A program that continues to work for Jennifer and Donald.
In the first 2 weeks, we both lost over 9 pounds.
And once you saw those first 9 go, then it was like, we can do this.
Jennifer and Donald are now on to phase 2, the Live It plan, which is also based on those habits.
A healthy lifestyle to better manage weight doesn't have to be drudgery. If it's well planned and executed, it can be an enjoyable way to live. People need to have a good plan, keep it practical,
realistic expectations, and enjoyable. And we think all these things fit in the Mayo Clinic diet.
Updated dietary guidelines from the federal government target obesity and reducing your risk of diseases such as type 2 diabetes, heart disease, and stroke. Mayo Clinic nutrition expert Dr. Donald Hendrud says the guidelines recommend you make small, realistic changes over time. Here are the basics. Eat more fruits and veggies, whole grains, fat-free or low-fat dairy products, and healthy oils. Limit saturated and trans fats, sugars, and salt. And drink alcohol in moderation.
Dieters also conquer portion control. For instance, a serving of vegetables is the size of a baseball. Fruits, a tennis ball. A carbohydrate serving is the size of a hockey puck. A protein or dairy serving size is the same as a deck of cards. A serving of fat about the size of dice.
Plus, be physically active. I'm Vivian Williams, and for more health news, visit the Mayo Clinic News Network.